What could be the reason for the tingling or numbness that you are experiencing in your feet? Because they are coated with a large number of sensory receptors, the soles of the feet of humans are among the most sensitive areas of the body. Their increased sensitivity can be attributed to the fact that they are constantly in contact with different surfaces. Your feet can help you distinguish between hot and cold surfaces so that you can react appropriately. They can also help you notice obstacles in your path so that you don't trip over them while walking, which will keep you from falling down at any time. As a consequence of this, tingling or numbness in the feet is a significant issue. You may start to lose some sensation in your foot, which will then get worse as time passes. If you're experiencing numbness in your foot, seeing a doctor about it could help you slow down or stop the progression of the condition altogether. Not only do you experience a loss of sensation, but the numbness itself may be an indication of a condition that is much more dangerous. Even though numbness in the feet is typically only transient, it can indicate a more long-term illness, such as diabetes, that is going on behind the scenes. How can you tell whether your foot is tingling or numb? Loss of sensation in the feet is typically the first and most noticeable sign of numbness in the feet. The soles of the feet are extremely sensitive, but the numbness will cause them to become less so with time. Because of this, you are unable to feel the position of your foot in relation to the ground, which impacts both your sense of touch and your balance, and will begin to interfere with your day-to-day life. In addition to this, you may also feel certain other strange sensations in your feet, such as tingling in specific sections of the feet without any touch whatsoever. A feeling similar to a needle being pressed on your feet, often known as a prickly sensation. A lack of strength in the feet. Your doctor will be able to diagnose numbness more accurately in your feet if you bring up these other symptoms. What could be causing the numbness? Note that sitting in one position for an extended period of time, which can restrict blood flow to your feet, may be another cause of temporary numbness. If this happens, your feet may fall to sleep, but the problem will go away as you stand up and restore blood flow to your feet. The tingling and numbness are symptoms of anomalies in the nervous system. The nerves may be injured, obstructed, or affected by an infection. Additionally, your muscles may be compressing them. This injury to the nerve is known as peripheral neuropathy because it affects nerves that are located in areas of the body that are physically separated from the brain and spinal cord, most commonly in the hands and feet. If the numbness is not temporary but rather persistent, it may be the result of an underlying medical problem, such as a spinal cord injury, diabetes, Lyme disease, frostbite, herniated disc, shingles, side effects of chemotherapy medicines, inherited disorders, multiple sclerosis, alcoholism, backache, among other illnesses. When should you go to the doctor for your numb feet? If the numbness continues for a significant amount of time, you should probably get it looked out. In addition to this, you should seek medical attention as soon as possible if you experience any of the following additional symptoms: severe headache, disorientation, trouble talking, numbness spreading to other regions of the body, breathing issues, inability to control bowels and bladder. If you experience any of these symptoms in addition to numbness in your foot, it may be a sign of a stroke, seizure, or mini-stroke, in which case you must seek emergency medical attention. It is possible to enhance blood flow to the nerves that are impacted by your foot numbness by engaging in activities and exercises that do not aggravate the condition. It is also prudent to put on some supportive footwear that is both comfortable and well-fitting for your feet. It is critical that you seek treatment for the numbness in your foot. The inability to feel pain in your feet can put you at an increased risk for foot wounds, stumbles, and falls. If you do not have good sensation in your foot, you run the risk of becoming cut or injured without realizing it. If your circulation is poor, your wound could not heal as rapidly as it otherwise would. If you treat the underlying problem that's causing the numbness in your foot, the symptom can go as a result. A correct diagnosis and subsequent treatment of the underlying condition that is causing the tingling are necessary for the treatment to be successful. Regeneration of the peripheral nerve cells is possible so long as the nerve cells themselves have not been destroyed. There is currently no treatment available for the inherited forms of numbness. However, the symptoms of many of the acquired forms can be alleviated with medication. As an illustration, maintaining a healthy blood sugar level in diabetics can assist in preventing the progression of diabetic neuropathy, while taking vitamin supplements helps treat peripheral neuropathy in individuals who are deficient in certain vitamins. If you have persistent numbness in your foot, your doctor may also suggest that you make an appointment with a podiatrist at least once each year. The following are some considerations to keep in mind. Always be on the lookout for any cuts or wounds on your foot. Put a mirror on the floor so you can see the bottoms of your feet more clearly, and wear shoes that fit properly and offer protection for your feet to reduce the likelihood that you may sustain foot wounds. Keeping these safety measures in mind can help reduce the risk of developing any further complications that may be brought on by having numb feet. Hope you liked this video. If you did, please give it a thumbs up and do not forget to subscribe to the channel. Thanks for watching.